Get
Gonna
started.
start it? Okay, sounds great. So hello, everybody. My name is Anna Rusinowski, and I'm the Chief Operating Officer for CDIQ Consulting. Welcome. We're welcoming you to CDIQ's Learning Hub free webinar, the Career Crossroads Clinical Documentation CDI Opportunities for Clinicians and Coders. We appreciate you joining our Lunch and Learn today and being the best part of our growing CDIQ CDI community. Now I'm honored to introduce our founder and CEO, Dr. Tarman Aziz MD, CCDS. Dr. Aziz is a health information management executive, internal medicine physician, CDI strategist, and revenue cycle consultant. Dr. Aziz is nationally recognized as an AHIMA speaker and educator, presenting at both AHIMA's 2025 Virtual Coding Summit earlier this year and Maryland's ACTIS chapter meeting. Make sure you check out his newest article on advanced documentation integrity, policy strategies for acute ATN capture, and risk adjustment in the Journal of AHIMA. Dr. Aziz, please take it away.
Thank you so much, Anna, as always, for that beautiful introduction. Sure appreciate it. And welcome to all of you today. I see some familiar names and I see some new names. Always good to see a mix of attendees in our free webinar series. We're just thrilled to be so active in the community right now with a number of events that you see up here on the screen. Particularly, we're anticipating our appearance at a pre-conference workshop enhancing CDI outcomes, best practices in documentation and coding at the National AHIMA 25 conference in Minneapolis this year. So if you're interested and want to learn more about how we teach and what we do in our apprenticeship courses and certification exam prep courses, do feel free to come out and interact with us at that free conference workshop. And today we're going to talk about what CDI is and why it matters for those of you who may be interested in entering the profession, and even those of you who are already in the profession. Maybe you haven't considered what you can do with your wonderful experience and training to date. And there are a number of opportunities that we'll discuss there. There are both on-site and remote opportunities. A number of people that express an interest in this particular webinar were asking offline about what it is that can be done in terms of workplace environments for remote opportunities. And certainly CDI is an area that really does lend itself to that remote work opportunity. Now, I will say as you're getting started, sometimes you have to work in an on-site setting, and sometimes that's better because you get a community that supports you. So we'll get into all of that shortly. We'll also talk about workflow and responsibilities for CDI professionals, the training options that we offer very particularly, both on demand and live online for your convenience. We have both formats. And you don't have to necessarily get into a full-length course with us if you just want to get your feet wet and try one of our modules. They are all broken out and available to you. And we even offer hourly professional coaching for those that are pretty well seasoned and just want some spot advice on particular topics that they're facing in their workspace. Most importantly, how do you position yourself for success within the CDI apprenticeship course? The short answer is come ready to learn a whole new skill set, regardless of your background, and you will always succeed with that honest intent to, from the ground up, learn something thoroughly. So there'll be a Q&A at the end. The recording of this session will always be provided and available on our website, on our YouTube channel, and will be emailed to you as well. The link to it will be emailed. So that being said, this session is really for you, and you don't need to wait for the end of the discussion. If you have a burning question, just take control of your microphone and jump in and ask, and we'd be happy to answer anything that's on your mind. All right, so CDI, the definition and purpose, it's really to ensure accuracy, clarity, and completeness of the medical record, and to make sure that what the providers are sharing with you in forms of their documented assessments in HMPs, progress notes, and discharge summaries, that there's a consistency to that that allows to align with the right ICD-10 code for what is evidently being treated. And that's not always so straightforward, right? We know that clinical providers are rightfully so focused on their clinical knowledge and their clinical acumen and getting the patient stabilized. So they may not slow down to realize that something that they've written down doesn't truly align with an ICD-10 code, not a big surprise that wouldn't be at the forefront of their minds. And it's not necessarily a skill set that they have as providers unless they've taken some training in that topic or in that field. So you're looking to make that alignment, and you're doing so in real time, which is a little bit different than the retrospective interests. You're really rewarded for that ability to look at a chart as it evolves and spot the likely documentation deficiency as it presents itself and evolves across the record. You will end up impacting multiple areas of your facility operations, whether it's reimbursement through diagnosis-related group assignment, something we'll talk about next month in more detail, or if you're looking at the clinical impact. So are you really reflecting how sick your patient is? That, of course, trickles down into quality metrics like expected mortality, expected length of stay, expected risk of readmission. So those are all things that we'll roll out in different webinars to come, and also on our offerings online through different videos and trainings. And remember that you also make a difference for things like patient safety. My goodness, if a pressure ulcer has developed or post-operative respiratory failure has developed, and it looks like it was completely randomly appearing in the patient's clinical course, could it be interpreted as due to hospital care issues and some sort of provider negligence? We know most of the time that's not the case. And so we'd want to clarify, was something present on admission? Or did the patient go into post-op respiratory failure because they have a wealth of, unfortunately, respiratory conditions that made that a likely outcome rather than an unexpected one that would suggest a complication? So there are many such considerations here that you'll be mixed up with in CDI. And it's a wonderful dynamic field. You won't be bored in CDI. You're always on the hunt for something new on the record, and there'll be a new challenge or 6 or 8 presented to you each and every day. And it keeps the clock moving quickly in your workday. You'll look up and realize you've put in your time and the day's over, and come on back tomorrow to follow up on those next issues. So very much an enjoyable field. I've been involved with it for 12, 13 years now, working from CDI chart reviewer all the way into program leadership, revenue cycle consulting, and medical director work with different companies. And finally now consolidated those efforts into our own company over the past year and a half or so. Very excited to be with you today talking about some of these topics. Why CDI needs you now, for example, is that there's mounting payer scrutiny and quality reporting issues that really present a problem. They really do present a problem to the hospital's metrics and operations. So you'll see that CDI specialists are in high demand. They are that bridge between coding language and clinical language. And there are so many stakeholders in the facility that are looking for your input. So why this serves as a career crossroads for you in particular, whatever background you might come from, clinical, coding, is that you're blending that unique skill set, that gift that you bring, and immersing it into a common workspace, the inpatient CDI chart review process, and the accompanying impacts that it has that we've already mentioned. And coders have that expertise already in ICD-10 and DRG assignment, and the DRG validation piece is well known to you. What about the clinical validation piece? Most inpatient coders already know how to clinically validate a record. It's just that their particular position doesn't officially require them to do so. So it's an easy enough jump for inpatient coders to make into CDI, and in fact brings a great perspective and a strength of knowledge. We all know that the PCS coding, for example, is quite complicated, and just understanding root operations to a level of depth and breadth really makes a difference to how well you can perform. Similarly, nurses and physicians with all of that clinical knowledge, assessment knowledge, diagnostic authority, and treatment planning, you have a chance to really understand what the provider intends to communicate through what is sometimes a little bit of haphazard documentation practice. And so regardless of your background, you really have an opportunity to train and fully apply all of your knowledge to a new workspace. Now, there's an expanding demand for CDI specialists. Even though I hear a lot of concerns in a given business week, it looks like there's not many jobs, or it looks like I'm not qualified for the jobs. In fact, the number of opportunities are on the rise, not on the decline. And it takes a little bit of a deeper dig sometimes, but there are plenty of even entry-level opportunities for those who have the right background. And the demand is such that you can also progress in your career. So you can make it into senior leadership positions on a reasonable timeline. And once you become seasoned enough, you can certainly jump into industry consulting roles, which are where a lot of the really great opportunities start to manifest. So, and particularly financially, it's quite rewarding to work in industry consulting roles. If you're looking to pivot, then there's a place for you to do so within CDI. Coders, again, may be motivated to do more than retrospectively look at the record, pick up a good ICD-10 code set, and maybe do some reconciliation type audit work on their own collaboration with CDI. Why not move into CDI yourself? You have so much to bring to the table. Nurses, maybe you've had enough of that clinical role. You certainly serve every day, and after the COVID pandemic, certainly a number of nurses, rightfully so, felt that maybe they'd given what they can in terms of a clinical career. Why not pivot to a administrative role with true career growth and an opportunity to work from home? And so many physicians, whether they're not practicing or they're retiring, but want to still have a hand in medical operations, this is a great way to get involved with CDI operations to help with payment denial defense and to help with those consulting projects in revenue cycle. So many physician specialists with a rich CDI background supporting consulting companies daily out there. So how are you going to get there? Let's talk a little bit here about certification. Certification is very important when you present yourself to the job market. Like any other job market, it's super competitive and it's seasonal. So those who are concerned about not seeing so many jobs immediately available, that could be a function of the week or the month that you did your search. And as companies and hospitals are presented with additional workload, whether they're selling projects on the corporate side or as there become different inpatient initiatives on the staff side of hospitals, they're going to need you. So how do you position yourself to be ready? Well, certification matters. If you're an inpatient coder, ideally you should become CCS certified, before you try to endeavor into CDI work. And ideally, you should be CDIP certified as well. We'll get to that. There's a question in the chat I see here. Is this a good opportunity for newly credentialed coders or those without vast experience? Liz, I would say newly credentialed coders, no. You'd want to put at least a year or two into working as an inpatient coder, because that's the strength of a coder. That's the strength that you bring to the CDI table, is having read a number of charts and seeing how providers sometimes present challenges to getting an accurate code set. So if you're newly credentialed, CDI can still be for you as a career, but you need to craft your CDI knowledge first. What about other non-nurse clinical experience like respiratory therapy? In the past, it was very easy to bring in a whole host of ancillary healthcare professionals into the CDI world. Again, what I would recommend to you is don't be dissuaded by blogs and Facebook posts and any of the negativity, word of mouth negativity. Of course, anybody with a rich clinical background can get into CDI work. Your path might be a little longer because you should probably get certified in coding first. That would be your easiest route. And if you don't like that route, at a minimum, become CDIP certified. So it shows you have some depth of knowledge about the CDI industry. And you can go to the AHIMA website to learn more about how to become CCS or CDIP certified in terms of the baseline requirements. But please, if you've got a clinical background of any kind and a strong curiosity about CDI work, be motivated, keep yourself informed, and reach out to us anytime, and we can give you more specific advice based on your specific background. Again, nurses and physicians, remember this is a non-clinical role. So we are used to in clinical medicine having everybody listen to us, whether we're nurses or doctors. We're in there with a degree of authority on patient care. And what we sometimes forget is CDI, regardless of your background. So you're going to bring that rich background and you're going to learn from the ground up. All right. What will you do in your work? Great questions, by the way. And thank you, Liz and Katie, for bringing those to us through the chat. Please continue to send your questions to us as we talk here today. What will you be involved with? First and foremost, the mandate of the CDI specialist is to look at 25, 30 charts a day. You're looking at 10, 12 initial charts, maybe 15, 17 follow-ups from previous work days. And you're doing the work concurrently so you can anticipate provider gaps in documentation and get them addressed through the query process right away. Another good question has come in. Any suggestions on where to look for open positions? I was told after getting my coding certification to do the ACTIS apprenticeship to assist with getting a job. I haven't found that to be true. Well, many people do very well with the ACTIS apprenticeship and do indeed find a job. Others don't have as much luck. And to me, what makes the difference again is that pre-employment effort certification. So if you were to do an ACTIS apprenticeship, you're then told you need 2 years in the industry to become CCDS certified. Fair enough, that's a difficult exam, which clearly the questions are written to show you've done inpatient CDI work for a couple of years. But if you have 30 years of experience as an RN, you're an ideal candidate from any apprenticeship, the ACTIS apprenticeship, our apprenticeship, to then go on and become CDIP certified, so that when you apply, that rich clinical knowledge has been, you let the employer know that rich clinical knowledge has been consolidated into a credential that shows your CDIP, approved and ready to help their department. The number of years that you've worked in clinical medicine does not necessarily translate to your job success. The apprenticeship does help to familiarize yourself with the information, but for example, our apprenticeship ends with a CDI prep course. It's built into the course. Yeah, most certainly. Thank you for your ongoing question. Very valuable one. Yeah, the CDIP certification is what I recommend for any newcomer to this field. And if you're a coder transitioning into CDI, make sure you're a CCS certified coder because it means you have mastered the inpatient chart review process in particular. That's what you really need to bring. That CDIP is icing on the cake then for the coder looking to come in. But yeah, 30 years of plus of RN experience. CDI would be lucky to have you. Please, however your route is into the industry, don't give up if you're genuinely interested in it. Query development is another big part of it. Retrospective review we'll come back to in later webinars, but essentially there are times 3 to 5 days or so after discharge that you need to get in the chart and take a look. You're welcome, Peggy. You need to get in that chart and take a look. And there's also roles in CDI like pre-bill chart review to make sure the right DRG is going out for final billing. So a lot of workflow issues that we will break out and have in other webinars. Today, I really want to be there for you to answer your questions about the career itself. Query development. What is a query? A query is a written communication to a provider which helps to identify and resolve documentation gaps. So if a provider is repeatedly writing right lower lobe infiltrate on the chest x-ray, yeah, we see the chest x-ray has a right lower lobe infiltrate. We also see you pick a pretty exotic blend of IV antibiotics for your patient. And we see that they're a status post CVA with severe dysphagia, and they're probably prone to aspiration pneumonia. So if it's aspiration pneumonia you wish to convey to us, dear provider, perhaps write that instead of right lower lobe infiltrate, because nobody gets paid for right lower lobe infiltrate, nor does it impact any quality metrics. Now, you certainly can't approach a provider in a query with what I've just said, right? You don't want to be cynical or in any way disparaging to their efforts to write something down on the record. So the query is posed as a very polite communication. Here are all the clinical indicators that we see. Here's what you've written. Here's a multiple choice set of options for you. Do you mean this? Do you just mean right lower lobe infiltrating? You don't really know what it is yet? Or do you really mean it's aspiration pneumonia that we're already treating? That's a reasonable thing to ask a provider. In the moment of writing down right lower lobe infiltrate, they're not trying to be deceptive or elusive. They're just treating their patient, right? So it's a matter about aligning. The query process then is very important. Sometimes we write queries to question if a diagnosis should even be on the record, not because we're questioning clinical acumen, but because we're questioning the absence of obvious clinical indicators that support the condition. So if the provider has insight into other clinical indicators that we don't see that do support their documentation, we'd like to just see them on the record. So that becomes a little trickier, the clinical validation query, wording it in a way that's not offensive but still gets the job done. You'll have a chance to collaborate with coders, coding professionals on the call today. You already know this, that you work side by side with your inpatient CDI colleagues. And it can be either a beautiful relationship or one that's a little contentious and filled with some elbows out animosity around which DRG is correct. Why did you put that as the principal diagnosis? I don't agree. Most of it's in the spirit of fun and intellectual banter. And rarely have I seen any real sort of negativity that would dissuade someone from working in the field. But certainly you have to grow a thick skin in healthcare. We all know that anyway. And just being professional and working with your coding colleagues goes a long way. And you end up learning something from each other. CDI specialists and coders teach each other something about their art and their skill set every single day. You'll also get to collaborate in CDI with others in the hospital, like case managers, quality teams, revenue cycle officials. Really, a lot of people come to CDI. It's a one-stop shopping for a lot of issues administratively in the hospital setting. And metrics, your own metrics will be reviewed very carefully in CDI. Your productivity will be examined, and you'll not be dismissed from the job if you don't meet productivity, not in the first instance anyway. The environment tends to be one of nurturing and supporting your efforts to get more efficient at that which you do. Your query volumes will be examined as well as how impactful they were. And the response rates from providers will even be measured on what types of responses they're giving to you. So much to learn and so much to appreciate in this field. It's a lot of different moving parts, as you can see. Ultimately, you'll have a chance to show each and every month how you changed hospital finance and quality reporting, which is a wonderful impact to make to the healthcare environment. Why work with us particularly? There was a comment earlier about the ACTIS boot camps and the apprenticeships, and those are wonderful trainings. I have ACTIS and AHEMA to thank for my career. That's how I learned, and that's how I moved forward and became certified and successful in the industry. What we found is that there's always a population of learners who prefer a slightly different approach to apprenticeship that resembles more of a university or college type of setting with a vocational approach to actually learn the job before you start the job. So you can hit the ground running, already knowing how to perform chart reviews, already knowing how to enter the proper reviews from CDI into that CDI software, and already knowing how to write queries and escalate them and get the response that you're looking for. So, of course, every organization, there's plenty of room for everybody in the industry, and everybody out there is doing a wonderful job. We bring something that's a little bit more niche and concierge in nature. We never have more than 2 or 3 people, maybe 5 at the most, in a live online class. Because any more than 5, you start to lose that individualized impact. Most people choose our on-demand, self-paced courses because I'm sure most everybody on this call can resonate with this. We're busy professionals. We have a life. We're balancing our families, our jobs, our own health, and it gets busy. It's hard to come 3, 4 times or whatever it is in a week. Some people come twice a week, 3 times a week to the live courses, depending what schedule they choose. Just not possible for everybody. So we've made sure that if you want to work in an on-demand setting, self-paced setting, you certainly can with us. And so also we have that ability to groom you through the entire, A to Z of how to do the job and get you ready for those certification exams. And we pride ourselves on also offering that support for job securing that first position. Now, to be clear, we're not an employment agency. We don't have a direct way to place you in any job at the end of our training. Many people rightfully ask that as well, but we sure do support you and make sure that you get where you need to get. We offer 1 year of support after your training ends with us. We put you through a mock interview process and we write a very detailed reference letter that attests to exactly what you can do. So a hiring manager may say, well, we preferred a CCDS, but this person has a CDIP and a glowing evaluation explaining that they're ready to start tomorrow with chart review. It goes a long way. It goes a lot further than you might think, and certainly further than the generic reference letter that says, gee, this is a swell person. Go ahead and hire them. Those reference letters are easy to come by and not particularly impactful. Ours are a little bit more structured to what you've actually learned and shown proficiency with. So the courses, I've got this table up, and we're not going to go through the whole table, obviously, but when you get the recording of this, you can certainly pause and take a look at this. The point is to remember that whether you have on-demand or live coursework with us, you even get some live support in the self-paced on-demand version. We do go over a diagnostic exam that we give you at the beginning in detail to explain the concepts broadly that are within the CDI, skill set. And then across the 4 modules of our course, our comprehensive CDI apprenticeship course, we, after each module, offer an additional 2 hours of live support where we go over all of your assignment submissions and make sure you're clear on the concepts, the ones that you did well with, as well as the ones that you perhaps struggled with. If you want more structure than that, you can certainly consider a live online course, and all of those dates are on our website and continually updated to reflect the upcoming courses. The career prep is the same. Whether you're in an on-demand or live online version of our course, we're still there for you at the end of the process. We're also still there for you for the CDIP prep, regardless of which of those that you pick. And again, it's important that you also know most people don't want to part with a lot of money in one transaction. We realize while we're not priced any differently than others out there in the market, we realize that some people would prefer a payment program. So we do partner with the companies that are listed on the bottom right there to make sure that you can have both interest-free and interest-bearing payment options that make the cost quite reasonable. So don't let cost limit you whatsoever. We have this CDIP exam preparation information on our website, CDIQconsulting.com. We'll have the website a few times coming up here. You can navigate to learn anything you'd like to about any of our offerings. Our full CDIP exam prep course is separate from the apprenticeship. Even though the apprenticeship has a CDIP exam prep element baked into it, we also, for those who have already taken an apprenticeship, already feel like they understand CDI pretty well, but just want that CDIP certification, we offer that as a freestanding course. It's a 600 targeted question-based course. It comes with study guides. There's a 50-question diagnostic exam to get you started. We then have 450 Q-Bank questions with extensive answers and rationales. So we actually tell you why the right answer is right and why all 3 of the incorrect answers are incorrect. And of course, the incorrect answers are also there for a reason. We've designed the incorrect choices to teach you something as well that may apply to a different setting or a different type of question. So every one of those 450 Q-Bank questions is packed with an opportunity for you to learn and really learn quite a bit before you ever hit the CDI workspace. And at the end, we give you a 100-question mock exam. It's our own mock exam, not one that comes from any of the other industries out there. And it's designed to gauge if you're truly ready for the exam, or if you need to take advantage of that 1 year of ongoing access, continue to revise your knowledge, check in with us from time to time on Zoom calls like these, so you can get your concerns resolved before you actually take a test. Again, we reflect the most current exam domains as published by certifying bodies. That also applies to our CCDS exam prep. We're not talking about that one as much today because this is more about a career crossroads, and we're suggesting that most people focus on the CDIP itself. Our comprehensive CDI apprenticeship course, to give you a broad overview, this doesn't really reflect all the details, of course. There's only so much we can fit on one slide. But module one is mostly about HIM operations. And even if you're an inpatient coder, you may not have looked at things like the inpatient prospective payment system or ICD-10 coding or principal and secondary diagnosis capture and things like that with the same lens or through the same eyes as a CDI professional would view that type of information. So beyond that, module two, you're looking at more medical diagnostics. If you feel nervous about reviewing inpatient records because it's been a few minutes since you studied pathophysiology and pharmacology, and you want to review more evaluation and management entries from sample entries from providers to know how you would act on them, then module two dives into that. Module three begins a true vocational approach to how do we do chart reviews and queries in the CDI field. And then module four is our professional development module, where all that extra workflow training, practice case studies, more chart assignments for you to really work with. We'll teach you how to download the cms.gov, recently made available last year, I think it was, practice encoder, so you can practice filling in your principals and your secondaries and seeing which DRG it groups to and get comfortable with the body of knowledge that you have to master. Again, most people prefer to save a few dollars and bundle all four modules together and take the comprehensive course, but you certainly don't have to. It's completely at your discretion. But each of these modules, if you wanted to discuss any of them at all, just get on our website. And there's never an obligation to jump on one of the free 15-minute consultation calls with me, and I would be happy to share more about any of the modules. Another question, would the full course prepare us to take the CDIP exam? Yes, it would. Good question, both in terms of the content of the course, as well as the fact that the CDIP exam preparation is built in. So you have a lot of the elements from our freestanding CDIP exam prep course are built right into the apprenticeship course. It's taught a little bit differently than the freestanding CDIP prep course because those in the apprenticeship by definition are new to the field and maybe new to coding as well. So the approach is a little different than the approach when you come in already knowing about CDI work, but absolutely the full course more than prepares you to take the CDIP exam. You again have to check with the AHIMA website to make sure you're eligible in terms of which credentials you already have, what degree do you hold, and things like that. But most everybody that comes onto these calls ends up finding they do qualify to take the exam, but they need the knowledge first and they need the training first. All right. If you don't want any courses or certification exam prep courses at all, we work with individuals at every level. You're very welcome. Thank you for the question. We work with individuals at every level of the hospital operations, whether it's C-suite and other quality and HIM leadership, new physician advisors who are still crafting their role, program leaders in CDI itself, or the specialists who are looking to improve their workplace performance. Maybe you've been doing CDI for 3 or 4 years and you love it and you just feel like you've reached a plateau in your skill set. Sometimes you just want to sign up for 5-6 hours of professional coaching where you can learn novel query interventions and new ways to think about the chart reviews. That's certainly something we like to do as well. And again, we have all of the prep courses. You see, we also support allied healthcare students who are looking to pass their different board exams as well. We really are a full service educational company, and we value so much our healthcare heroes and everybody out there looking to advance their careers. On our website, you'll also notice that all of these free webinars, you can watch them the recordings are linked to the website there. You can see at the bottom of the screen. And we've also started to populate our YouTube channel that we're very excited about. That's growing, and we'll share more on social media about our YouTube channel as we get a little bit more of our content loaded up there. It's something new for us that we're very excited about. Um, and you'll always see at the top free upcoming webinar series date and topic. You can see today's date and topic is currently there. We'll be updating that later this afternoon to reflect next month's Learning Hub free webinar, which is from DRGs to risk adjustment, the first step in your CDI journey. And here we'll dig a little bit deeper into the elements of that first module on health information management operations, and just exactly what will you learn about the coding guidelines? What will you learn about how to discern provider assessments and if they're good enough to support coding? And how does that workflow really appear in a week for you? How do you collaborate with your coding partners? So if you're interested and you want to take a deeper dive, do feel free to join us next month, Tuesday, September 23rd, at the same time, 12 noon Eastern. And we'd love to have you. We'd love to, get into the details of what the job actually entails a little bit further. But in this particular call, I really want to hear from you. Some of you have answered or asked rather wonderful questions. I'm happy to answer more of them, either by way of the chat that's been ongoing here, or again, don't be shy. Grab that microphone and share with us that which you're interested to know. Any one of you, thank you for listening. Appreciate your attention, and over to you as a group, ready to take any questions you might have.
Dr. Aziz, I have a question. I know there's some people that we've received a lot of emails, people asking about CDI being remote work. Maybe you could just touch on that. I know in your past you've worked remotely in this industry a lot, so maybe just touch on that.
Sure. Thank you, Anna. Good thing to remember. Yeah, I have had the opportunity to work in both venues, and when you're getting started, there is a value to the on-site role, not just because you have a team that helps to nurture and develop your career, but when it comes to those provider queries that we're sending out, a fair amount of the escalation when they don't necessarily respond right away uh, can be uh, sort of accentuated by going to meet the provider either face to face or getting on the phone with them or networking with them through lunch and learns and presentations to their department. So there's so many ways in which you learn your craft a little bit faster as a on-site employee of CDI. That being said, we know that COVID really changed so much for many of us that life changed. Remote work almost became a mandate for many of us. And if not a mandate, certainly a preference. And so there are a multitude of remote opportunities in CDI as well. And it's true that many of them appear to require a lot more experience or, than maybe you've got, or even at coming out of an apprenticeship and a CDIP certification course, you feel that maybe you wouldn't qualify. Our advice is apply anyway. If you apply with sincerity and you find the right opportunities, especially if you're CDIP certified, you have a very good chance at interview. And the mock interview process will help you get those treasured remote opportunities as well. Once you have a little bit of experience under your belt, the remote opportunities really expand for you, particularly at the second year, after the second year, when you become eligible for CCDS certification. Once you're CCDS certified, now you can work for staffing agencies, for example, that are constantly called upon by different companies and different hospitals to support their workplace needs. You'll get paid a little bit more as a staffing company employee rather than a hospital employee. And again, there's so many companies out there that the number of jobs you can apply for goes up. So yes, remote opportunities are abound and available. And then when you move into revenue cycle consulting, same story. A lot of remote opportunities with just a little bit of travel here and there, depending on the nature of the company and the work you're doing. But there is quite a bit of opportunity out there for you. So it's just a matter of applying yourself. If it's remote work that brought you to this webinar today because that's your interest, just know that it's out there for you. Thank you for that reminder, Anna. Other questions from the group or anything else, Anna, you're welcome to bring up as well. It's a quiet group today. Only a few of you have shared questions. That's perfectly fine. Yeah, thank you, Liz. Yeah, apply anyway is so important. It's so important to remember. Those are words on a piece of paper on a job ad that HR and a few department leaders came up with in their best attempt to recruit the right applicant pool. It doesn't mean that others wouldn't be considered. And you'd be surprised how many people with all the so-called right credentials on paper, they just can't pull it off at interview because they don't really have the wherewithal to communicate that which is known. When you're interviewed, for example, you'll be asked basic CDI questions. Patient presents with dyspnea. They've got both pneumonia and acute heart failure. How are you going to decide what the principal diagnosis is going to be assigned there? You know, do you know how to look for the most resource intensive condition, the one that took up most of the hospital's time and money to treat? So this is why we have the mock interview process to really groom you and help you to understand what to do. Yeah, always apply. Unless you're clearly not qualified for the position, that's different. But if there's any kind of gray area, this and that certification preferred would be nice if you have 5 years of experience. Sure, it would be nice if you had 20 years of experience, but employers oftentimes have to hire the person with the right initiative and the right skill set in the moment. So never give up because of a seemingly dismal job ad that makes it seem like go away, don't apply. There's no need for that. Remain confident and keep your hopes high. Someone coming on the microphone, please go ahead with your question if you have one.
Yes, if you were to do the on-demand course, like the full comprehensive course, about how long? It says 40 classes. So like what on average is a class length? How long does it take to complete that and get all that done?
Thank you for your question. That's an excellent one as well. And the answer is it can be as fast as 3 months.
Okay.
Some people are able to whiz right through the material. They take to it very quickly. They apply themselves. They work nights and weekends because they want to get that done quickly for themselves. Others may take the whole 1 year, to do the course. I think that's maybe a little too slow. So there's a happy balance between 3 months and 12 months. But it's not something you can jump into lightly, right? If we're going to endorse you to be literally job ready, it takes a
Yeah.
little bit of a time commitment. So we're talking around 90 days, maybe up to 4 months for most people. So that's starting from the diagnostic exam. Then remember, the 40 classes are just the 4 modules.
Hmm.
There's then 15 modules. We'll get into this in other webinars, but you have a 15 module CDIP prep course to complete as well before we get into the heavy duty mock interview and interview prep and reference letter type of thing. So it's 3 to 4 months is probably as fast as you'll get from point A to point B with us.
Okay. All
Good
right, thank you.
question. Thank you so much. Appreciate you. Other questions for us today that we might answer? If you've thought about becoming a CDI professional, now is the time to do it. There's many of us out there in the industry who can help you. This is how we help you. We take you through a very careful step-by-step training process, and so do most of the others out there in the industry. You have to find what works for you, whose style fits your style, and that's why we encourage any of you that are interested, just book one of those complimentary calls with us. You don't have to buy a course afterwards, or nobody's going to pressure sell you in the call. We just really want to get to know you and see how we can support your career growth. If there's no other questions, we're going to go ahead and end the call for today. Certainly appreciate everybody's time. Thank you so much for being here today. As Anna said, you're the reason that we do what we do. And we'll welcome hearing from you in the future. Look out for the link with the recording to this session, as well as information on how to come to the next one in September. I wish you all a great afternoon ahead. Thanks again, everybody.